Hi, welcome to Case of the Day. Today is Thursday, so it's the last case of this week, and so we're on the 47th case, and that means next week we're going to hit 50 on Wednesday. And this is the Morel-Lavallee lesion of the anterior knee, and I hope I'm getting the pronunciation right. So this 29-year-old had injury to the knee 5-6 months ago, had swelling. Then ultrasound 3 months ago showed a collection, aspirated thrice, kept coming back, and he came for an MR yesterday. I read it today. And you can see that there is this collection here between the deep this is a superficial and deep subcutaneous fat and the fascia. And you can see a very nice wall, of course, with septae and debris, etc. And then you still see fat adjacent to the patellar tendon. And you can see that beautifully on the axial images here. There's still some edema of the subcutaneous fat, and the supero-inferior extent on the wider field of view is here. And this is a classic Morel-Lavallee lesion. Now, these are degloving lesions due to shear injury, separating the deep subcutaneous fat from the underlying fascia with hematolymphatic disruption. And these two articles, I think, would be the best bet to understand. They give these color pictures as well. All of these have been drawn by Matt Skalski, who's an amazing person. But I think it just shows the concept so well that you can see the subcutaneous fat sheared from the deep fascia, and then you get this injury. These are the common sites. The commonest is adjacent to the greater trochanter on the lateral side of the pelvis and hip, but the knee, the anterior knee, is also reasonably common. There are 6 types, of which really the type 1 occurs almost immediately, type 2 is after a few days or weeks, and type 3 is when we get what looks like a chronic organizing hematoma, but that's usually on aspiration. Otherwise, you'll see exactly what we see here in our patient. And this is adjacent, this is along the lateral thigh, but the same thing applies here. So you've got a T1 intermediate, T2 bright, septate debris, and a capsule, telling us that this is a type 3 chronic Morel-Lavallee lesion. The main differential would be prepatellar bursitis, but I think even clinically, the history of trauma, and usually a significant trauma, the swelling occurring after trauma, would be enough to make the diagnosis, and of course the location. Prepatellar bursitis is different. The bursa is typically applied to the patellar tendon here and the patella, and you can see that here, very subtle bursal inflammation. And then sometimes if it's infected, then you can see this larger, thicker bursa. But this is different from the Morel-Lavallee lesion that I've shown. So it's important to be aware of these. In private practice where I am, we don't see them too often because the acute ones typically occur with significant trauma. But nevertheless, we should be aware. We should mention these in the report. Try and classify them if possible so that they can be then appropriately managed and treated. That's the Leadership Summit, my WhatsApp channel. And thank you so much for viewing this.